Good morning everyone, it's Matt here from the Performance Lab Physio Practice. Today I'm going to talk about knee pain and particularly knee arthritis in middle-aged people. We see a lot of this at the Performance Lab, and I'm just going to run through one of our case studies from a good few months ago. It was a 52-year-old lady who came to us really down and low in mood because all the things she loved doing over the years she's had to stop, and now her knee pain is giving her considerable issues during simple activities in the day. A bit of history: this lady used to love running. It was a massive part of her life, and probably up until her mid-40s she was doing 3 good running sessions per week, looking at between 5 and 10 miles. And then at some point around that time, she started to suffer from knee pain. At that time, she went to the GP. The GP arranged an x-ray for her, and it was confirmed that she had moderate levels of arthritis in her right knee. At the time when this was diagnosed, she was told categorically from a number of people, so that was a physio, GP, even the consultant that she went to see, that she had to stop running to preserve her knee. And this was a big thing for this lady because this was everything to her. So she took the advice and stopped running. Unfortunately, then has been able to do less and less as the years have progressed. And obviously nothing that really gives her the enjoyment that she had previously. Now, when someone comes to us in that situation, we categorically don't rule out going back to anything such as running, hiking, or any of these activities that will put extra load on your knee. First of all, we've got to explain what is going on with regards to knee arthritis. And knee arthritis is just a normal condition. When we put extra pressure on our joint, it wears down a little bit, and it actually lays a bit of extra bone down to try and help support that joint. So what I say to my patients is, arthritis is a good thing. It's trying to stabilize your joint, and that's good for us. When we look at young athletes, so studies have been done on professional footballers under the age of 24, we know around 37% of these have moderate arthritis, but they have no knee pain because they have the musculature around the legs to be able to support that joint. And that's the key to all of this, okay? Every joint in your body, we say, has got a load tolerance level, and this is it. Okay, if you work underneath this low tolerance level, then you don't have any problems. So previously with this lady, she was doing her running maybe 2 or 3 times a week, and at that point she was coping with it, no issues. Now when she thinks back, she thinks that she may have upped the amount of exercise that she was doing. So as we said, something usually takes you above that low tolerance level. Now, if you go above that low tolerance level, then the first thing that happens is that you get a pain reaction in that joint. So with an arthritic joint, it causes pain and it can cause a reaction and swelling. Now, this is the issue. The pain then switches the muscles off that support the joint, and very quickly you get weakness, so your low tolerance level drops. Now, some of the things here that you used to be able to do without issue now give you a reaction. So you rest a little bit and you start to go back to these things that used to be easy. And this is quite disheartening because these things now give you irritation. So what does that do? It leads to more weakness, which reduces your low tolerance again. You end up with a low tolerance level down here, when for you to have a normal everyday life, you need it up here. And what happens is you just keep going in and out of this level, aggravating the knee, getting more frustrated, more worried about it, and end up just backing off and live your life in this lower level. And this isn't really acceptable for most people. So when you come and see us here at the Performance Lab, our first job is to find what level is it that you can accept. Once we find this level, we can train you, we can strengthen you, and we can work on all the right areas. We then try and nudge this level forward. Sometimes we get a reaction, but we don't worry about that. We just let it settle for 48 hours and then we nudge again. And we get up to a point where we reach a plateau. Now for some people, that may not be returning to running, but it might be something that is acceptable for them. But for a great majority of people, and including this lady that we saw, we were able to get her jogging twice a week again, which is a massive thing for her self-confidence, her mood, and everything else. So the crux of the story is really, when it comes to arthritis, don't be worried about it. Get the professional help from us guys over at the Performance Lab. We'll try and explain everything, reduce any fears that you've got around that. And then we can make a plan going forward, and hopefully we can get you back to the level that you want to be at and to lead a normal, happy life. So that was just a bit of a tip on arthritis. We'll be doing some more videos over the next few weeks, just discussing some of our cases and how they can help you moving forward. So bye for now, and have a good day everyone. Thanks.